You're welcome right back on Africa Business Radio. It's been an interesting time so far. I've had my first conversation for the morning, and we're getting right into our second conversation for today. And don't forget, it's that show where we host conversations that help entrepreneurs, that help professionals to succeed. And yes, I'm having someone very, very interesting joining me right now. We'll be talking about leveraging health tech to provide a structure for sustainable health care. And I've got Dr. Ebi Ofrey, the co-founder and CEO, Gerald Care. Good morning, Dr. Ebi. Thank you so much for joining us this morning.
Good morning, and thanks for having me.
All right, so let's just start the conversation now with Gerald Care. Tell us, please, what Gerald Care is all about before we get right into the topic for the morning.
All right. So, Gerald Care is a health tech company that's pioneering what we call medical inclusion. Quite a few of us may have heard about financial inclusion, which is leveraging technology to provide financial services to unbanked. Well, Gerald Care is leveraging technology to provide access to medical care to people who ordinarily would not have received access to care. They're focused mainly on the elderly and on rural areas at the moment, and we're looking to go into more segments going forward.
Nice. That's a good twist to it. Now, the health sector, as we know, in the past year has been very challenged. I mean, COVID-19 came with a whole lot of hurdles. Was there any challenge, for Gerald Care in this regard? Did they have to twist and turn to like every other, sector?
So, contrary to what happened for other businesses, it seems to have been a better year for Gerald Care. As that was the first year we actually made a profit, in the sense that people began to throng towards what we do. So in a nutshell, Gerald Care Home Hospital, which is the elderly part of it, is providing home care or home doctor visits to the elderly. And so we realized at that point that many other people also need home hospital visits, because there was an aversion to going to hospitals. And though there was telemedicine, they still would rather see a doctor. And so we had to create another segment called the on-demand medical service for everybody else that was not elderly to access home doctor visits. And so we had a surge of visits for the year, and it enabled us to have a better year than we've had before.
Nice. I also hear that you also run a cloud-based service. Tell us about that one.
All right. So what we realized was that when you go to a hospital, the only person you really need to see is the doctor. You don't have to see the pharmacist or the lab scientist. And so we discovered you don't even have to be in the same building with them. So what we did was convert the patient's home into the hospital or into the doctor's consulting room, where he appears connected to everybody else you need. So like a typical consultation, he reviews you, he examines you, but when he needs medical requests, instead of writing the prescription, he makes a request on his application that goes to our pharmacy network who deliver to you at home. Same for medical tests. He makes a request, it goes to our network who sends phlebotomists home to take a sample. So in essence, you receive everything you receive in the hospital, but in the comfort of your home.
Nice. So this is turning people's homes to their clinics, which is, very, very suitable considering how people really wanted to stay away from other people because of the pandemic. Now let's talk about, the entire health sector now in Africa. Of course, Gerald Care, you guys are leveraging on tech and you're doing huge things. As you mentioned, you made your first profit last year. So how do you think the health sector as a whole can leverage on health tech in Africa?
So for us at Gerald Care, our key drive is impact. As such, we focus on getting to as many people as possible. So for health tech to have an impact on health going forward, they need to focus on getting to as many people. But what we realize is that the mass of Nigerians are in the rural areas. And so you need to provide a solution that can get to them. Over the past 4 years, I've been really working with various models. And then my partners and I came up with a model we call the PAP model for sustainable healthcare. So PAP basically means P for payer system, A for accessible, A for affordable, and P for preventive. So the payer system basically means that most times the person that needs the service cannot afford the service. And so we need to develop a way whereby the person paying differs from the person using the service. So for Gerald Care Home Hospital, for instance, the adult children of the parents make a payment for their care. So the elderly themselves don't have to pay for treatment, but their children can pay for them. And then we have a second product I mentioned for rural areas. We call it Medra Telehealth Box. So this basically is a teleconsultation device that works with or without internet and is solar powered. So anywhere the box is located is the clinic for that community. It's currently deployed in one location in Delta State, Ogeye community. And then the model is that companies, NGOs, non-developmental organizations, and all that kind are the ones that pay for the service for the community, because the community themselves may not be able to afford it. So we need to find a balance whereby the person paying receives enough benefits to want to pay so that the person can receive it. And so we're able to provide them data and other things they need real time simply by them sponsoring a community and providing a box for them. So we're not mining data for data's sake. The money used, sent, or the money provided is actually to provide medical care for those people. The bonus is that these companies receive data and have, goodwill engendered to them. For the home hospital, the children are the ones that make a payment. We all understand that at the end of the day, if anything happens, we are still the ones that pay. So it's better we begin to pay as a subscription service for our parents to prevent the unexpected eventuality. So that's the payer system. We now talk about affordability. Now in the US, affordability is described as about 9.8 or something % of your household income. So the person paying, the amount is paying should be at least or maximum 10% of their income. And so what we realize is that for us, most of the children, the subscription is about that price. And for the organizations that pay for the boxes, the amount they pay is even less than 10% of their income. And so it's affordable to them. We have accessibility. No matter how wonderful your product is, if the people can't get it, then it's useless to them. So for us, when you hear rural communities, the question that comes to mind first is there is no internet there. Yes, there is no internet, but we don't need internet to see them with the solution we have. And so we're able to get it through the doorstep. The last is preventive. We understand that, because of the level of infrastructure we have in Nigeria, if you eventually get to that complicated condition, there is no structure to care for you. So the key is to see people regularly and ensure they don't get to the point where they need that care. When you say preventive, many times our mind goes to awareness, lifestyle changes, but in some conditions, some things have already happened. And the faster we nip it in the bud with medical care, the better for us. So when you see them regularly, you catch conditions at the earliest possible stage. And that is what has made us have quite an impact. And so the model is P for payer system. Make sure the person paying can afford it and is different from the person using it. Secondly, it must be affordable to the person paying. Thirdly, the solution must be accessible to the people that need to use it. And lastly, it must focus on preventive and not curative or episodic care.
Nice one. That's great stuff, really. All right, so let's go back to your profile now on Gerald Care, of course. In 2019, you guys made the top 30 African healthcare innovations by the World Health Organization. Now, how has this achievement been for you?
It has been great because as a startup, we all know our lifeblood is credibility. But usually because you're a startup, you have no track record. And so it's great to be endorsed by an organization like WHO. So even if anybody has certain doubts, they see the endorsement from WHO and they seem to have more trust in your capabilities and what you can do.
That's true.
The other way we're trying to mitigate that was to have partnerships with known entities, but endorsements like WHO were key to us. We also won other awards like Top 50 Innovators in Africa by the Africa Innovation Summit. So that was also key. Top 10 Global Impact Accelerator Program. All these were things that helped cement our credibility. I tell people that the reason why we go for these competitions most times is not just because we want to win, but because at the early stages you have no track record. And so the more endorsements you can get, the better for you. Fortunately for us, our relationship with WHO has been ongoing, and so we have various events we do with them, especially because once they want to come into Nigeria, there are certain sectors they want to get into, and they need to focus more on startups because they've had not so nice experiences with the more orthodox, channels. I don't want to mention names.
Okay.
And so they started focusing more on startups. So we even had a hackathon with them recently, in which the group I was in, or our company was in, came first. We also had publications from WHO. Last week, another was published showcasing what Gerald Care is doing. And so all this help, garner trust in what we do, and it help us get more customers and, basically do better.
Right, amazing stuff you're doing. I'll have to wrap up this conversation at this point. But just before I let you go now, how can interested listeners now get across to you, say they need your service and all?
So you can go to our website, www.gerocare, that's GEROCARE.org, not .com, so
okay.
.org. You can get us on Twitter at GeraldCare_NG, on Instagram at Gerald Care, and on Facebook at Gerald Care Solutions. Either of the channels work well for us.
All right. Thank you so much, Dr. Ebi Ofrey, for joining me, for being a part of this conversation. Thank you so much.
Thank you for having me once more.
All right. Dr. Ebi Ofrey is the co-founder and CEO of Gerald Care, and we've been talking leveraging health tech to provide a structure for sustainable health care. That one was an amazing conversation. Don't worry, if you missed out, it's going to be on our podcast channel in the next 24 hours. Thank you so much for being a part of this. Stay here.